everybody. This is Kara Thrasher Livingston with Senior and Disability Services. And we wanted to welcome you to our Care Coordination Monthly Outreach Webinar. And we're glad you're here. And if folks are still joining, we wanted to go ahead and get started. We have two special guests here today, our Director, Anthony Newman, and Emily Ricci, who is Deputy Commissioner for Medicaid and Healthcare Policy. I'm going to give us a few updates and a little bit of time for Q&A. So go ahead and take it away, please. Thank you. Thanks for being here.
I can start off, Deputy Commissioner. Can you hear me okay?
Yep.
Can you hear me okay, Kara?
Yeah, you're good.
Absolutely.
Okay. I just wanted to say hi. Tony Newman, and is my name. I'm familiar to some of you as the Deputy Director of the Division of Senior and Disability Services. When John Lee left in August, I have stepped in as acting director, and we have a new Deputy Commissioner who I would like to give an opportunity to say hello.
Hi, everyone. Thanks for inviting me to join you today. It's nice to meet you all. My name is Emily Ricci, and I'm the Deputy Commissioner in the Department of Health, and I do oversee the state's Medicaid program. I come from the Division of Retirement and Benefits. I've been with the state for a while now, probably on and off for about 10 years, but I've worked a lot of work with the state retiree and employee health plan, and I'm excited to join the Department of Health and to work with Tony and his wonderful team. So.
Thanks, Emily. I just thought I would say, tell you a little bit about our care coordinators. They are the providers of a very important service to Alaska, and they are about the most passionate, dedicated, ethical folks that you will ever meet. And they are out in our communities supporting, connecting, advocating for our people on our waivers and those on our Community First Choice program, elderlies, children, adults with disabilities, children with disabilities. I think right now we have about 190 care coordinators certified in Alaska, and so I think we've got a really good cross section of folks today if we've got so many participants. So as I recall, Director Lee and Deputy Commissioner Wall had met with this group before, and we set up a goal of meeting with the care coordinators through this forum on a quarterly basis. I know it's been a little bit longer than that, but I did want to express the interest of the division to keep lines of communication open as we move forward, and Deputy Commissioner Ricci and her team get into place, and I know she's already expressed to me a real desire to be engaged with our stakeholders like you. I think it might be nice for you to hear about some things at the department level. Let me start with just talking about our new acting commissioner, Heidi Hedberg. She comes from the Division of Public Health as their director, and will be in the acting commissioner role until the legislature formally approves her, which typically happens toward the end of the legislative session, if the past is any guide. So maybe some of you know her from her work at Public Health. She was often by the commissioner's side and the governor's side during the pandemic, and so we're real excited to be continuing to work with Heidi in this new role. When I think about other things on the department's plate, the one thing that comes to mind to the top is the pending public health emergency. It's continuing, the continuing public health emergency. This group tends to be pretty well aware that the public health emergency from the federal government remains in place, but maybe some of you are surprised to learn that since it's been such a long time. We don't know yet when the state will, when the federal government will consider the emergency formally over. Our currently thinking is it's going to be April 11th, 2023, and that we'll be receiving advance notice in mid-February. As you know, we developed regulations that will allow some of the flexibilities that would otherwise have ended with the public health emergency to continue. So we've tried to be clear about when the flexibilities will be maintained, when they will end, when they will keep going. And so I wanted to recognize the Division of Public Assistance because they're going to have the real heavy lift. When the PHE, the public health emergency, ends, states must return to normal Medicaid eligibility and enrollment operations. So there's a variety of expectations that our colleagues at the Division of Public Assistance are going to need to meet. They'll have up to 12 months to initiate a full renewal for people enrolled in Medicaid, but it's going to take an all hands on deck approach from the division staff. And I think I heard this morning that they're going to be bringing on some 60 or more staff to assist with that effort. Some of you are probably shuddering to think of DPA being in an even more challenging position than they already are. And you've expressed to me through CAT and directly about your concerns about status of Medicaid applications, how long things take, the difficulty in reaching a real person to help you with issues you might have on behalf of a client. I will tell you that I was heartened to hear this morning in a meeting that I got to have with Commissioner Hedberg and Deputy Commissioner Ricci that they are very much aware of the concerns that care coordinators and many Alaskans have regarding public assistance, and they are going to be working on a communication plan to do what they can to help ensure that it goes as smoothly as it can and that people understand the challenges DPA is facing and how they're going to address them. So I'm really heartened to hear that that's going to be getting a lot of attention from our department's leadership. I don't know, Deputy Commissioner, if you'd like to add anything to that.
No, Tony, I think you covered it, honestly. I think that the more we can do to communicate kind of what's happening on our end, what people can expect when they interact with the Division of Public Assistance, you know, the better the whole system will be on the outset. One of the things that I think people get really frustrated with is when they feel like they're interacting with a faceless bureaucracy. And so to the degree that we can remove that through kind of helping people understand what they can expect, you know, I think that will hopefully start to ease some of the stress that we're hearing about and seeing. But ultimately, the Division of Public Assistance has an enormous workload that they're undertaking right now, and they're facing the same workforce challenges and technology challenges that I think all of us are facing. So.
Okay, thank you. Yeah. So what I thought I would do, Kara, now is talk about some of the other things that I've been paying attention to at the high level, and then I'll stop with a few minutes to spare and turn it over to Q&A if that works. I wanted to touch base on the things that when I was asked to step into the acting director role, Commissioner Crum and I talked about the things that really needed attention over these next couple of months while we got through the election and a new team was going to be installed. So the first thing that he advised me to please keep my hand on was the rates issue. As you know, that's really two projects. One was the $32 million that the legislature put into the budget, and we had to figure out how to get that across the board, 10% rate increase to our providers. We appreciated the work that went into that on behalf of the department and the legislature. As some people may know, the legislature at first, because of interest they were getting in this from the personal care community, was initially only going to make that rate increase possible for people doing personal care services. But good dialogue with the legislature and the administration, we were able to make sure that 10% rate increase was extended across all the Medicaid services providers, waiver and state plan services. But we did have to check with CMS to make sure it would happen, that it could happen. And CMS gave us great ideas, and it took a couple of months, but we were pleased that we were able to make that retroactive to July 1st. Other things had to happen too. Harmony had to be reprogrammed. It took time and communication with the Division of Healthcare Services. I know from the outside it can often seem mystifying why things like this can take so long, but I can tell you that good communication with the Office of Rate Review, our sister divisions, made that happen as quickly as it could. The second half of the rates issue is rate rebasing, which many of you know has been completed, resulted in new rate charts and regulations that are out for public comment now until the end of this week. So if you haven't already put some comment in and looked at the rate charts and watched the video we produced that explains how some of the rates were derived, I please encourage you to do so. You've got a couple of more days to get some input to us. Whenever I meet with stakeholders, I take the opportunity to note how important grants are to the SDS community. Our grantees, and by our grantees, I'm talking about people who provide nutrition, transportation services, maybe adult day, outside of the waiver process, outside of the waiver system. So it also refers to our independent living centers, our ADRCs. They have been particularly hit by the cyber attack that hung up our web platforms. And that, along with short staffing in our grants and contracts unit, have been really hard on our grants recipients. It's taken us longer to get grants out, and it's been harder to get responses to grant questions. But our grantees are really critical. They serve a lot of people in a cost-effective way, and I just take the opportunity to thank people who. The people who work in our grantee agencies. I know that you are our waiver providers, but I know you work closely often with our grant agencies, and I just wanted to mention how important they are. And our grant manager tells me that things are really starting to improve, that grants are getting out faster, we're getting notices out faster, we're getting money out faster, and things seem to be getting better. So wanted to mention that. I wanted to mention another thing that the commissioner asked me to make sure was getting accomplished, and that's the ARPA, American Rescue Plan Act, enhanced FMAP funding. That was the money that we got an enhanced federal matching percentage if we made some improvements to our home and community-based service system. After a lot of stakeholder dialogue and input, we dedicated the money to supporting our DSPs, our direct support professionals. So we have two projects underway there. One is basically helping DSP supporting agencies get recompensation for things that happened during the pandemic. So if they had to pay overtime, if they had to make recruitment bonuses, things like that, we're helping them recover some of those costs. We've gotten $7 million out the door to them. We're doing another allocation here shortly, and that's been a big lift, but we're happy we've been able to provide relief to those people that employ direct support professionals. And the second project is a longer-term vision project. That's the DSP Training and Certification project that we are doing in collaboration with the University of Alaska. And that's enabling the University of Alaska's training cooperative to become accredited as a NADSP, that's the National Alliance for Direct Support Professionals, an NADSP accredited body, so that we can give out a DSP certification for people who complete coursework over the next 2 years. So that's a pilot project. I'm working closely on that one. I'm very excited. We have about 120 students, DSPs, who are working and also taking these courses and working toward their certification under the NADSP certification program. And then the other big lift that sort of landed in our laps this summer was the waitlist eradication project. The legislature, in the budget bill that they passed, put intent language in that said they wanted the Department of Health to develop a 5-year plan to eliminate the IDD waiver waitlist. And We, thanks to the Mental Health Trust, were able to hire a consultant to work with us and do a lot of the lifting that requires. I know many of you have come to our webinars. We've had 2 on that project in our plan. We've gotten great feedback. One care coordinator in particular, last meeting, asked the question if we were making sure to account for the 100% federal funding that tribal recipients receive from the federal government. It was a great question. It's helped us refine our numbers. So I've appreciated feedback like that. We're going to hold one more webinar. I think we're aiming toward December 15th to talk about the plan, and I wanted to give you all an early heads up. Make it if you can. I think I'll end there. We have lots of things that Kat and Kara bring to my attention. I know that there are lots of specific things about Harmony, forms and letters, public assistance concerns. I want to encourage you to continue to work with Kat, our care coordinator liaison, with those concerns. We're really fortunate the trust has funded this position to give you a direct pipeline to the division. And Kat is, I talk to Kat frequently about ideas, about ways we can make improvements. It's not always easy to turn the ship of state on a dime, but we do our best, and having Kat on board has really helped facilitate a lot of that. So with that, Kara and Kat, I think I will turn it back to you and see what kind of questions or comments people might have to share.
Okay, sounds great. Thank you so much, Tony and Deputy Commissioner Ricci. We do have a couple questions here, and I encourage you to go ahead and type in your questions, and we'll read them out, and everyone can get the answer like we always do. We will post our video on YouTube too afterwards. Just give us about a day to get everything ready and up on YouTube. We do have a few handouts for you in the handout section too. If you're able to download them, go for it. If not, don't worry, because we'll send them to you in an email after the session as well. So the questions, just a comment, it says, I think the DPA crisis is a perfect opportunity and time to revamp the system. So words of encouragement on that. There is a question that says, will it be retroactive regarding the new rates when they come out as outlined in current regulations? Do we know if we can answer that one? Would rates possibly be retroactive?
You know, I thank you, Kara. I've said all I really can say about rates because they're in the public comment phase right now. I just wanted to give you an update, but in the interest of protecting the public process around rates, we can't hold a private audience with any single group regarding the rates. So I'm unable to answer any real rates questions at this time, I'm afraid.
Thank you.
And I encourage people to use that process, the public comment process. And I can make sure I get to you the link to that if anybody would like it within easy reach before we hang up.
Okay. I see there's a question about Appendix K flexibilities. We actually have a little bit about that coming up in our presentation that we'll do. So just hang tight for that clarification. Questions for Anthony Newman and Deputy Commissioner Ricci about their projects and things they've been working on. That's what we're looking for right now. I don't see new ones yet, but probably people are thinking and typing. Sometimes the internet does that. It sort of makes you wait a little bit before questions come in. Okay.
Go
ahead. Yeah.
Okay, I was just gonna, I just take an opportunity again to talk about the waitlist eradication project. You know, that's what the legislature has requested is a plan. It hasn't made a commitment to fund the elimination of the waitlist. They're simply asking, if we were able to eliminate the wait list, how would you do it? I'm excited no matter what happens. I think it's going to lead to some great conversation, some real sort of reckoning with SDS services and discussion that I'm just really excited that the legislature is going to take up this coming session. So even though they've just asked for a plan, haven't committed to funding the plan or supporting the plan or doing anything with the plan really, we're pleased to be able to get them one just so it can further a dialogue about SDS and our system.
Mm-hmm. Thank you. There's just a couple of thoughts. I think that folks are really thinking about, what we've presented and the current issues that care coordinators face. A couple of us have chimed in about the entries required in Harmony for amendments. I know that you talked about that a little bit, Tony, just working with problem solving around that. And so this is our audience that we're presenting to. So just know that we're working on learning more about the issues and creating options. There's a few of us talking about the 10% incentive and thinking about when that ends. Will agencies still be able to pay that rate, or what would that be like? I know that's certainly been a question in the whole development of this story about what that would be like. So there's limited funding for these things, and it's a bigger question, I think, than we could address here, but I appreciate the thoughts about it. If you want to add anything, go for it.
Mm-hmm. Yeah, thanks, Kara. That's a good response. One of the things that's confusing is the number 10%. So the ARPA Enhanced FMAP project left 10% of general fund that we would normally have had to pay out for HCBS in the department's purse, so long as we use that to expand and improve our HCBS services. Another 10%. There's also the 10% that the legislature improved in general fund, which equates to $32 million. So it can get a little confusing. The 10% that the legislature approved, the $32 million, that's gone into the base. That's a permanent rate increase that will continue. The 10% that's coming through the ARPA project is a different set of money. It's a different project. That money will run out eventually, and we are supporting. We're using it to address some short-term needs that I described, like the helping people recover costs from the pandemic. We didn't want anybody to become locked into needing that funding, and we've made it clear from the get-go that it is money to help them recover costs. But the other ARPA project, that DSP Training and Certification project, I am excited to think that that's going to be a long-term project that remains in place. We've already begun discussions with the Mental Health Trust. They're very excited about that project. So the hope is that that will result in a long-term ability to offer a certification program for DSPs that's going to outlast the ARPA money. So that's a conversation that's continuing, and nonetheless, I'm pretty optimistic that that'll be a long-term thing that we'll be able to see for Alaska.
Okay, thank you. This a question for Deputy Commissioner Ricci. Are there plans to make DPA more visible to the end user, sort of like the PFD website where people could possibly check on their own status or do documents and things like that?
That is a great recommendation. I'm kind of on week 4 of my job, to be quite frank, which is just enough to be dangerous. So, I don't know what the end plans are right now, but I would love to take that recommendation back because, it intuitively makes sense. So thank you. Any other recommendations that you have as well in terms of what would be useful, please send those in. Tony, I'm not, who would they contact? Would it be you if they want to send tips, kind of ideas?
Well, I tell you what, I have reached out to my counterpart at DPA to ask if DPA could come to the next care coordinator info share
Oh, that's right.
And I'm hopeful that you'll get a direct pipeline to them. One of the suggestions we heard was that, wouldn't it be great if there was somebody at DPA like we have Kat here at SDS, and a direct pipeline so that questions could be answered. I haven't gotten a response yet, a good response yet on that. I think that might be more challenging for them to do than we were able to do. We actually got funding from the trust to be able to support Kat. So that would be a longer term project if it's even possible. But that's my hope, is that you will get a direct pipeline to Tama Carson, their deputy director, or Shonda O'Brien, their director, next month. But in the meantime, I think Kat continues to be the best conduit that we have into the division, and then she and I can talk about how we can get, collect questions and get them into DPA's hands.
Thank you.
Thank you. All right, questions here. Just a few more. We're at 2:28 right now, so just a couple more. Just note too that our audience is usually aware that your questions are available to us in a report. So just know that we do get them and refer them, if possible, to resources that can answer them. When we have too many, then too many that we can't, when we can't answer them in the time allotted. Okay. Thoughts here about the recent care coordination study. How does that connect with realignment or developing new ways of supporting the care coordinator industry?
I think I assume that's referring to the study that was commissioned by AADD
Yes.
that Kimberly Atkinson took on.
Yes.
Lots of good recommendations on that in that report. I believe that Kat, you are in dialogue with Kimberly, and is that accurate, Kat, about that study and some of the recommendations in it?
Yes, we were talking about having a meeting and kind of going over the recommendations and maybe saying what we are already doing to meet those recommendations kind of before they even came out, and then maybe what we can do to address some of the other ones and some of those issues. So it's in the works. I think with the holidays and the time off people are taking, that's gonna delay things a little bit, but.
Mm-hmm. Yeah. So yes, that's a living project with us, and I think it's provided some great discussion for Kat and her supervisor, Caroline Hogan, and to talk about how we can direct Kat's work over the next coming months.
Okay, sounds great. Well, we're right at 2:30 right now. So I want to thank you again for joining us. I know that we had to let you go at 2:30, but we certainly appreciate your time and your willingness to talk with us in our group. And we're excited to get your updates. So thanks again.
Thanks, Kara. Thanks, Kat.
Thank you so much for having us.
All right. Take care. Bye-bye. Okay. So we'll go forth with our agenda here. Thanks again for sending your questions, and we welcome them all, even if we can't answer them all right then and there. But let me share my screen again, and I'll make sure that it's visible. Our agenda.
It's up here, Carol.
Yeah, we can see it.
All right, I just want to move it a little so it goes down and we can see the rest of it. Or most of the rest of it. Okay, just some quick updates here. Regular healthcare visits for your clients. We thought it would be helpful to remind us that it's the end of the year, of course, and there may be lots of reasons impacting why the people you serve may or may not have been going to regular healthcare visits. meaning well child checkups and regular checkups for adults. That type of thing is something that we're wanting to support for people we serve. And hopefully people will go back to doing that, being as COVID isn't as impactful. We know that our healthcare providers are still going through staffing shortages and things like that. So we know that that can impact that practice as well. But just a quick note to encourage people to get regular healthcare visits taken care of. And of course, you can put that in your notes for your monthly encounter with the person, your contact with the person, as far as updates, which is helpful for when you submit the next plan. Anything to add to that, Kat?
No, I think you covered it. I think if you are having issues getting medical documents like QDCs or VODs, reach out to me or training, and we'll kind of guide you through that. But nothing to add. Thank you.
Okay. We did place in your handout section an Appendix K Flexibilities summary. It's a look at Appendix K Flexibilities, and we thought it might be nice to have a quick and easy reference. I don't know about easy, it's still pretty wordy, but a reference document that lists the Appendix K Flexibilities and how we came to know about them. So let me see if I can grab one of those and open it, and we'll just give it a quick look. All right, I'm just moving a few things around here. So we get a lot of questions about this, and the intent of this is to just give us a summary. So we feel that it would be helpful for folks, and all kinds of different providers have asked us for, what is this information and where did it come from? So we basically refer to two alerts that went out. The first one was way back in June, and it gives a nice list of the flexibilities, and that is a link to the actual alert. But this is a list of the active flexibilities. They need to be justified and approved in a support plan, and we can have these flexibilities active until 6 months after the federal public health emergency ends. That means that it has to be declared over from our federal resource, okay? Department of Health, federal Department of Health. So waiver settings requirements, so that people who visit homes could potentially be limited to prevent the spread of COVID. Service limit increases as noted, respite, and dehabilitation. Expanding settings where services could be provided for certain services. Dehabilitation, for example, could be provided in a residence. Residential supported living could be done at the person's residence or a different residence. Intensive active treatment, adult day, and employment services. They all can include the option of distance delivery. The flexibility to pay legally responsible individuals to provide respite, ResHab in-home supports and supported living, and DayHab. Provider qualifications to allow online first aid CPR trainings to meet certification hiring requirements and suspend the hands-on skills test for CPR. Temporary program administrators don't have to meet program administrator education experience qualifications. Delay the requirement for our employment services workers to have proof of national certification in employment services or an equivalent certification. And it says renew support plans for a year without holding face-to-face team meeting. This means that it goes together with care coordination services being able to be delivered in a telehealth modality. All right, continue to use distance delivery as it stated in the original email, meaning telehealth modality, in lieu of in-person contacts. The date of the actual e-alert, the dates that are in there are from that e-alert, right? There's an extension that extended it as of October 14th, meaning the public health emergency was extended on October 14th. Okay, so Appendix K short form is still accepted as a renewal when services haven't changed. State plan services are different. They're made flexible. It's under Section 1135, personal care and CFC, personal care and chore. They allow a legally responsible person to be paid to provide them. However, that flexibility will end for those services upon the date that the federal public health emergency ends. They are not extended for 6 months. Okay, so because they are state plan services. So that's a quick look at the actual flexibilities. In October, another e-alert went out saying that the public health emergency was extended effective the 13th. And I wrote the 14th. You get it, okay? So assuming a full 90-day extension, this PHE will run until mid-January 2023. Okay, so that is an extension of that. If you want to project 6 months out from that, that's our concept of how long Appendix K forms would be accepted. So 6 months from mid-January. So we'll be looking for another extension or an end, as we have been these many years together with COVID and how it's gone. And that is really the best clarification that we could give right now to the questions about the Appendix K form, the flexibilities, and the thinking process and framework around the end of the public health emergency and who declares
Kara,
it and stuff.
Really quickly, and there were a couple of questions about that. We did communicate in the e-alert that AppKs right now will be accepted for all plans. I guess if you meet the criteria, just submit an AppK for plans with a start date of 4/1/2023. So you can continue to submit AppKs as renewals if there are no changes in services. If it's not until 4/1, but it's for plans with a start date of 4/1.
Okay. So yeah, there's questions in there about Nemet too. Care coordinators cannot request Nemet. They are not Nemet requesters. We included this flyer to, that's non-emergency medical transportation. We included the flyer to help you understand how to talk with people who may need non-emergency medical transportation. Delight, did you want to add?
Yeah, Kara, there's like a slight, I think that there's the infographic with Nemet that people are looking at. It does say that who can request Nemet, and it says care coordinators, social workers, and healthcare providers. And that's not 100% accurate. Like,
It's old. It's probably because we grabbed an old one. So
yeah,
that's on us.
sorry. We
okay.
apologize for that. But really your role would be to help someone talk through in that earlier discussion about getting annual appointments, helping them realize, do I need Nemet to be able to do that? And then you can connect them to these resources and be able to, and at times you might have to contact the provider with the client and tell the provider, hey, we need Nemet, please help us because we need to get our annual exams done. So I just wanted to clarify that across the board because we got a lot of questions on that. The care coordinator
sorry about that.
does not have a responsibility to do that, okay? You're more of like a resource to help people know that it's there and make sure that people tap that resource when they need it.
Yeah, apologize for that. We've had a few webinars today, so it's been fast and furious around here. Anyway, thanks for catching it though. All right, awesome. Let me move this a little bit here and show my screen again. And move some things around. I make sure I see what you're seeing. Okay. Just some quick reminders. SDS assessment can be in person or via telehealth modality. There isn't a rule that says they must or must not be in person or via telehealth modality. Same thing with care coordinator visits. You can visit people in person if the person's comfortable with it and you're comfortable with it, and you can do a socially distanced, safe visit. That is okay. Yet you do have that telehealth modality option. I saw a few questions in there about the flexibilities made permanent regs. So we're going to have some more information come out about that as closer to the end of the public health emergency as we get this info coming to us. Right now, the concept is that the Appendix K flexibilities actually are more, they cover everything right now. We're not enacting the flexibilities made permanent at this moment. However, the regs are, they're effective, but in terms of your description of care coordinator services or care coordinator services themselves, our AppK flexibilities are, meaning that all of our visits can be telehealth modality, are still in effect. So they sort of cover the flexibilities made permanent. So I'm hoping that that's a little bit helpful or a little bit more clarification for you. Let's see. Hang on. All right.
And I'll just add really quickly along the lines of the flexibilities and the new regs. I don't know if this was on our agenda. I think it was. We were going to talk about it. If you were getting plans that are kickback, because when you talk about care coordination services and in the frequency you talked about, two visits per month or 2 visits per year, or kind of however you worded it, the review units will be more flexible in accepting support plans that have that kind of language. So I think you'll be fine now going forward, and you shouldn't get incomplete notices for that. If you do, let me know, but I think we were able to work that out.
Okay, a couple of us have given clarification around requesting Nemet. We are not prepared to go into Nemet training right now. Yes, people who request Nemet have to have a medically necessary reason for it. We have taught in the past, and I'll just give a reminder that most of the people we serve do have medical conditions that are ongoing. The best suggestion is to, if the person's going to use Nemet and it's done through their medical provider, okay, so it's not really a care coordinator thing, their medical provider can do a regular visit along with a visit for a condition, and the visit for a medical condition would make that be a Nemet ride. Okay, so layers upon layers of info, but thank you for reminding to offer that clarification. Okay, in your Harmony provider record, remember to go in and mark yourself as accepting new clients or not accepting new clients, please. Anything to add to that, team?
No, we did email those instructions. If you need them, we could probably email them again after this meeting, just as a reminder. But that, if you go into your record and update it, that'll help GDRCs who work with families to kind of have a shorter list of care coordinators to call as opposed to calling everybody. And as a reminder, the default is no. So if you haven't done anything and that report is pulled showing providers, you're going to come up as saying, no, you're not accepting new clients.
Okay. All right. And Delight sent us all a new updated T24 Care Coordinator Harmony Guide. So we are offering, we're hoping that you all receive that. And even those of us who are care coordinators but unable to attend this exact meeting also received it. So all care coordinators got it. And this is just a quick summary of the changes. In Chapter 1, clarifications around inquiries. And that is times to file an inquiry when the care coordinator already has access to a consumer record. There are situations in which you'll need to file another one for that person. Screenshots have been updated for inquiry list view. Viewing and filtering the inquiry chapter. Chapter 6, transfer of care coordination. Clarifying CFC protocols, meaning only one inquiry needed for a transfer. Chapter 8, other plan actions, late support plan submission form. Multi-select replace with dropdown, limited character count for narrative detail, new screenshot, and the Appendix SDS staff contact list. Now I know that this team has worked very hard on all of those attributes. So what can you add for our care coordinator group about any of these? Go ahead.
Oh, I'll let Delight speak on this since she's been working super hard on getting this updated. And thank you to her and the whole training team for working on that. And I know Delight's also working on some videos for you guys. So in addition to the Harmony Guide, there's going to be some additional videos. So subscribe to our YouTube channel. We're trying to be trending. We're getting more followers, but it's not quite enough to be up there with all these other ones. But Delight, if you want to kind of talk about the updates you did, that would be.
Yeah, I think that, you know, as you all know, we're doing some cleanup on CFC. So as we go through those cleanups, I'm trying to capture the major changes that would impact in like in live time and sort of fine tuning them as we go. So we recently did a really deep dive in inquiries. So we redid that entire section. If you read that chapter, you'll notice that it has been adjusted to indicate when you would file an inquiry outside of just needing access. Most likely the care coordinator already has access to the record. So what are reasons why you'd file an inquiry for opening a program? So it goes through that kind of content. We also added some information on filtering as well that's going to pair with the video that I'm recording with the two staffers that look at your inquiries. So we're going to start trying to do these chapters and video breakdowns so that you can kind of get a face to the name that, you know, if possible, for the folks that are actively working on your work product so that you have kind of a connection with them. And just as Kat mentioned earlier, some of the holiday scheduling is tricky, so we're having some stuff like that, but the content's pretty much tuned up and ready to be formalized in a guide. The big CFC kind of adjustment is that when we have on Chapter 6 for transfers, if a client already has CFC, only one inquiry is needed, and it's really just the waiver. You can just use the waiver program to indicate that there's a transfer occurring to hand off that record to another care coordinator in Harmony. And then for the late support plan submission, we actually have adjusted this area because you guys were being incredibly thorough. Like so thorough that it was getting difficult for us to pull data from. So we actually narrowed the information in that area because we really just need a really brief description of why a plan is late and one selection, a drop-down selection for why, because we're trying to get broad categories of data to better inform us of some of the struggles that you're experiencing when, like, why would we have a late plan? And so we limited those areas, changing it to a single drop-down choice, limiting the character count so we can pull data more effectively out of that area to be able to better understand why we may not be meeting a performance measure. And then the staff contact list, we did come up with that and decided to put it in the Harmony guidebook, because the last info share, you guys were like, we need that. And so we just put it together for you and put it in there. It's pretty topical, right? So, kind of based on topics, the unit team that you would email or DSM, always remember to use DSM if you're working with PHI. But some of these teams do not work with PHI, like certification. So you'll see that there are areas where it's just a regular email. So just, use those resources to your benefit to help your clients. That's our intention for you. And as always, if you're working in the guide and you notice something's weird, something doesn't make sense, either to Harmony, to the guidebook, or even to you, just please reach out, because that's a really huge beast of a book. And there are probably mistakes, yes, because humans made it, and Harmony may have its own thing going with it. And we just need you to contact us if you've spent more than 15 minutes trying to figure it out. You have lots of chances to do that by either contacting Kat or coming to the CC office hours, because we don't want you spending more than 15 minutes battling a piece of Harmony, because it's probably not you. Something might be happening. So reach out, and that's kind of it, what I had. Just kind of looking and seeing what questions we have. So one of the questions is that, it's very rare for only one reason for a late plan. It's okay to choose the single version in the dropdown and then list the other reasons in the narrative. That's okay. What we found happening in having a large character count and a lot of space is that some people were putting in PHI into the record, like the care coordinator's PHI, like your own health. You were like putting in your own health about yourself. And we don't want that, because that's then tied to that record onto that plan, and you may not be the care coordinator on that plan forever. So it's really been we're trying to just narrow it down so that we're getting a broad concepts, broad topics. If it's late because of having difficulty getting signatures, or illness or hospitalization or anything like that, you can keep it on really general terms. Okay, it's okay. I know that you're like, what? You guys always want it to be so specific. You want all the details all the time. I know. But in this context, it's okay to just give us the broad picture. I know. I know you're like, I don't know. But really, it's okay to just give us like the cliff notes on why it's late. And looking back.
And I just want to validate everybody's comments and emails and smoke signals about the issues in Harmony, where we are aware and we know there's been some hiccups. And make sure you clean your cookies, by the way, if you haven't done that. And we know and we understand that the plan services is kind of a pain, is said nicely. It's a challenge, and it's a challenge for everybody. So we are aware of that, and we're kind of looking to see maybe if there are alternatives to that. And you guys have to understand that section is kind of connected to the plan validation, and it's connected to certification, and it's touching a lot of different sections, so it's not really easy to disconnect it and not use it. So it's kind of a bigger issue, just stopping to do it. So we are working on maybe a potential solution, just trying to see what our alternatives is. We're not making any promises, just want to make that clear, but we are exploring what other options we have, and Tony is aware of all the struggles that you guys have had with the plan services and how much longer it takes to complete a support plan or amendments, and especially for folks who cross that 637 one date or have multiple amendments. So we are aware of that, and we are actively, I mean, we had a meeting about that earlier today, the late, exploring kind of what our options are when it comes to that. Again, no promises that that'll be changed, but we are definitely looking at it. It's just touching a lot of different parts in harmony, so we can't just disconnect.
We can promise that we're trying to do something about it, because it's not functional the way that it's going right. Yes, it's functional in the sense that it's working, but it's not functional in the amount of assistance needed. You like, it's not just you. So if any of you are like out there being like, it's just me, I just don't get it. No, it's not you. It's really tricky. If you remember when we originally did the trainings in this area, this is what I call the combination lock, because if you miss one part of it, it just won't work. And so we really do recognize that, and we are looking for any tools that we can leverage to try to ease the complexity of this area. Kat nailed it. It's interconnected to too many things. So hang in there and please ask for help. We really do want to help you with it. We're just looking at questions. Some questions about, like, can we go back to paper? That actually has its own bundle of chaos as well. So because of our ADA requirements on a federal level, paper forms are also incredibly complex and cumbersome. So is the fast answer to go back to paper? I don't know. We're not sure if that's true. It's just we'll keep it on the table, but it's not, even if it's tempting to go back to something familiar, that has its own complexities as well. And it's one of the reasons why we transitioned and retired the paper form.
If we didn't get to your question, we will go through those Q&As, but you could also email us. So if we didn't get to answer your question, or if you need us to follow up on something, make sure to email us. We had 111 people, I think, at one point. So there were a lot of comments, a lot of questions, and we might have missed something. So reach out to us if you need us to follow up on something, if you haven't answered the question. And office hours are at 4 o'clock today, if you want to come to that.
As Maria noting, it's like, it takes way more than 15 minutes to do an amendment. Oh, yes. Yes, it does. When I'm saying the 15-minute, I mean, like, if you don't really even know where to start to do the amendment, please just come to office hours. We'll case consult it with you, because sometimes different providers have, like, it's not just rates, it's like they change their name or something wild is happening that's really case specific. And if you're just trying to figure out where to start with it, just we're happy to do a case consult. These office hours aren't like crazy busy. We have room for you. We would make time for you. And if you can't make office hours, please send us an email and we'll do a one-on-one Zoom with you, because we know it's hard. Like, saying it's hard is kind of an understatement.
That's so nice, July. That's so nice.
Yeah, they're very tricky. Yeah.
Really good reflections. We really.
Everybody's time. Oh, sorry, Sarah. Kara, go ahead.
Okay, that's okay. I know folks are chiming in about different like interactions with review staff and what they add to plans and why they add it and what happens when you present that to a family and things like that. Those are all really good things to know. We're not prepared to answer every single question. I can only just echo the team that says come to office hours if you have a particular issue, and we'll work on it. We'll do our best to get it solved or refer it to someone who can. We have been here for an hour, so I want to let everybody go. and say thank you again for coming to our monthly Care Coordinator Info Share and participating with us. We'll look for our video to be placed on YouTube and an email to come out. And it'll be the one that says this email is equivalent to your 1 hour CEH. We don't offer separate certificates for these. We just had so many folks that were unable to download them from the automation of it. We just changed over to sending an email, and provider certification is aware of that. So give us some time though. At the end of the day, we do have office hours still, so it'll probably come out tomorrow. And that being said, I just want to thank everybody for coming and go ahead and close our session. Thank you.
Thank you.